Hello everyone, dear chairs and dear audience. I'm Viktor from North Macedonia, and today on the behalf of my team, I'm here to present our PrEP pilot that has been ongoing from the last year on. This is our logo, the PrEP logo for our pilot. So first of all, a bit of history. The first talks for PrEP program in Macedonia started in 2018, and then with the help of the WHO, especially from Ioannis Mamalitsis and Pietro Vinti, we have drafted a protocol for our pilot, and this actually represents an example of a WHO collaboration with us, with the community, so it can be a community-led research. Then in 2021, with the help of our friends from the Alliance of Public Health, the Global Fund and the SOS Project, we finally have been able to procure the funds and the needs for starting our project, which was in the end a collaboration between a partnership between our organization, Stronger Together, and the University Clinic of Infectious Diseases. So briefly, our pilot protocol, our objectives were to assess the feasibility of PrEP provision in a network of clinics and other sites within the network in North Macedonia. So this was the uptake, and to determine the acceptability of PrEP to high-risk groups such as MSM, transgender people, and sex workers. And this would be the persistence of the PrEP use. This was, in brief, our protocol, our scheme of the PrEP users. So we had baseline visit, and also we had follow-up visits on the 1st, 3rd, 6th, 9th, and the 12th month. This, I should tell you, was drafted by the earlier version of the WHO guidelines, which were, I think, 2019. So now this has changed for the 2022 guidelines. On every visit, we had a PrEP navigator, which was a community person, a doctor, a nurse, and a social worker if there was a need for one. This was the package that we offered. As you can see on the slide, it was really a comprehensive sexual health care services package. Out of all these things, we weren't able to procure, unfortunately, only the HPV vaccination. Everything else we did tests for, and we provided our users with it. So this is actually I will start with this before I go to the results. This is our greatest success of the pilot program. Finally, in July 2021, we have managed to publish the National PrEP and PEP guidelines in the official gazette of the country. And as you can see here, the minister is signed on this. So from now on and through our program, we finally have guidelines, national guidelines on PrEP and PEP, and that's like set in stone now, and we are very happy for this. About the results of our pilot, the total number of interested participants were 89, where only 64 people were left, but we were really content with this number, and 25 dropped out, were unsuitable or dropped from the program for their own reasons, which gives us a retention rate of 72%, which actually brings us that we have great primary objective, acceptability and persistence. We managed to do this. What else? This is the demographics of our group. The vast majority of the population were MSN. We had small percentage numbers of transgender people and of females, and there were unfortunately no people who inject drugs included. Then our mean age of the participants were almost 32 years old. 11 out of 89 people previously used PrEP, which is a low number. They would all like to use PrEP to provide greater protection from themselves, and in the almost all of the participants took an HIV test in the last year that they were tested. Then the number of sexual partners was between 1 and 6. in the past 6 months, and out of 83 participants who had sexual intercourse, 69, or that's 76%, did not use a condom for every sexual intercourse, which told us that we really did great with the group that was offered PrEP. What else? The higher number of, the more percentage of not using condoms were the people who had insertive anal intercourse, related to the ones who did receptive anal intercourse. 94% of the participants stated that they expected to have sex without a condom in the next 3 months from the inclusion in the study. This was really important for us because this was actually one of the main inclusion criteria to enter the PrEP pilot. Then some of the results from the follow-up visits. This is the dosing regimen that the people chose at baseline and then after 6 months when they were asked. So at baseline, more percent of the people chose on-demand dosing, so 2-1-1 dosing. But then after 6 months, 20 from the people changed. So the percentage changed overall, and then now we have more people that are using daily PrEP than on-demand. The adherence was actually really good because when you sum up all of these percentages here, you get some 70% adherence number, which is really great for not missing tablets. Interestingly, the condom use of participants was declined in the people who used the PrEP on demand, and interestingly, the daily dosing regimen peaked the first month and then plateaued for the rest of the follow-up period, and the number of sexual intercourses and the mean number of partners constantly increased during the time in both of the groups. What else do we have? So 64 respondents stated, 53% stated that they used a condom after starting PrEP. This is they used a condom at least once after they started using PrEP. And the risk ratio is like 3 times higher that they will continue using condoms even if they're on PrEP. The results from the ACI's tests were the most perplexing to us because we had only one new HIV infection. This was on baseline testing, so we had no new HIV infection in the people that were actually initiated on PrEP. Then for syphilis, this was the really perplexing one. We had 10 on baseline and 4 syphilis new infection on follow-up, which represents an incidence of 16%, which is huge, and we're trying to make the government or the Ministry of Health aware of this problem. We had 3 participants who came back on positive for hepatitis B on baseline testing. They were immediately put through the healthcare system. There were no hepatitis C infections, and we discovered 2 chlamydia and gonorrhea, actually 2 chlamydia positive infections into participants. What's our takeaway from this and our experiences? So how we differed from other pilots in the region and in the world, I think. We offered not only daily, but also the option of the event-driven dosing regimen. Then we offered HPV vaccines, which we administered to 23 people, as well as chlamydia and gonorrhea testing. We have included not only MSM, but transgender people, sex workers, and people who inject drugs. There was this novel concept that we invented, that's the mobile PrEP unit, the mobile PrEP service. We used a van that we use for mobile testing, for testing, and we went to other cities in the country where we offered PrEP. We went the navigator, so the community person, the doctor, and the nurse to other cities. We took blood and we took the necessary forms. We came back to the laboratory, the tests were done, and then after the results were ready, we shipped through cargo the medicines to the persons that were in need. So this is a really novel concept for us. And of course, apart from the expected administrative and COVID-19, because as you may know, 2021 was the peak COVID year, so we had difficulties with that. We also learned that there is still a big stigma towards PrEP within the community. So we are working on this and we want this to not be an obstacle anymore. And yeah, that's pretty much it from my presentation. Thank you very much.